Well, good afternoon. This is a great day to be in Jacksonville. I know the weather's not very good, but the announcement's very good. And I'm glad to have Mayor Curry here. We also have Manisha Brown, who's the Director of Public Affairs and Government Relations for Walmart. We have Renee Pabon, the Regional Health and Wellness Manager for Walmart, and Marvin Baldoff, Regional Market Manager for Walmart. Today is a great day because we're announcing the expansion of vaccine availability in the state of Florida. And as you might see, that will be expanding to Walmarts all across the state of Florida beginning at the end of this week. We had been working with the feds for about a month to figure out when we'd be able to do a larger pharmacy program through the federal pharmacy program. They are identifying certain doses for each state, and then the state is identifying certain pharmacies to be able to receive them. And so when we finally got the word that the program was going to be turned on, we obviously wanted to work with Walmart on this because we know how many Walmart has a really significant footprint all across the state of Florida. So beginning on Friday, there'll be 119 Walmart stores across 34 counties that will begin offering COVID-19 vaccinations for senior citizens. And this is over 30% of their total footprint in Florida, which is a really, really good start. They're getting allocated about, about 25,000? So around 25,000 doses for the Walmart portion of the mission. And I think that they have a great plan. They're spreading it pretty far and wide. And then as those doses increase from the federal government, they'll be able to do more shots at each store without much of a problem. We're here in Northeast Florida partially because there's a great announcement for Duval County. They're going to have 18 Walmarts right here in Duval County that are going to start giving shots on Friday. And so that'll be really, really good for folks in the Jacksonville area. But it's not just that. There's going to be one of the Walmarts in Baker, one in Bradford, one in Clay, and one in Columbia. And so some of those areas didn't have the Publix footprint. And so when we talked to Monisha, we talked to the Walmart team, we said, okay, there's a certain Publix footprint. If you guys could take a look at that and then look at your footprint and focus on areas where you didn't have a retail pharmacy footprint already, that would really be helpful. So clearly, Duval was one of the ones that didn't have the Publix. Now, Duval's done very well. 42% of all seniors have gotten at least one shot in Duval. That's better than the state average because you have a good, strong hospitals and a good health system. But I think this will supplement those efforts and really, really be good for senior citizens. So the federal pharmacy program also allows us to expand to other retail pharmacies. So we've already had the relationship with Publix, but that was when the state would get an allocation. Some of those were set aside for Publix. Obviously, we said the hospitals, county health, state sites, church missions, all these different things. These are additional doses, not even counting what we're already doing from the federal pharmacy program. So Publix will also get more doses now than they had been getting just from the state. And so they are also going to expand. So right now they're in 325 pharmacies across 23 counties. Starting by the end of this week, they will be in almost 600 Publix stores statewide across 41 counties. Now we already have them in Nassau and St. John's. There'll be 6 Publix in Clay County, and there'll also be 1 in Columbia County. It's also important to point out when you talk about Walmart, they also have the relationship with Sam's Club, of same company. And so they're going to be offering at both Walmarts and some selected Sam's Club. So when you go to schedule a vaccine appointment for Walmart, you visit walmart.com/COVID vaccine. But you can also go to samsclub.com/COVID vaccine. So again, that's walmart.com/COVID vaccine or samsclub.com/COVID vaccine. And you do not have to be a member of Sam's Club to be able to get a shot at a Sam's Club pharmacy, which we obviously very much appreciate because we want this to be as widely available as possible. And of course, many seniors have already successfully made appointments with Publix. Some have tried and haven't been able to get through. Well, there's going to be more appointments for this week, and Publix's website is publix.com/COVID vaccine. So I think that The retail aspect of this is going to be very positive. I think Walmart has so many folks in the communities who shop here on a regular basis. This is a place they're comfortable with. You got a lot of great employees that work here. And if you look on your way out, if you look where they have the setup for this, I think it's going to move very smoothly, and I think it'll be a really good operation. So I commend Walmart for getting in this, and I think you're going to see a lot of positive developments. If we're over 40% of seniors, or 42% of seniors in Duval right now, without even having these pharmacies in the mix here, just think we're going to be able to add to those numbers and have a majority of seniors in no time, and hopefully as many seniors as we can. Now, I don't think every senior has wanted it thus far, but I think the vast majority will, and that'll be really, really good. People will ask, well, when are you going to do this group or that group? We will move on when we have done right by the seniors. We're doing seniors first, 65 and up. Folks that are not 65 with comorbidities are getting shots through hospitals and physicians. We're not having that at retail just because I think refereeing that is difficult. But we have all 65 and up. So we have a third of seniors, of our 4.5 million seniors, over a third have been reported to have had a vaccine, but the reporting lags. And so we've probably done close to 1.7 million seniors that have gotten at least one shot. Florida is the only state that's even crossed 1 million thus far. I think Texas is about to do it. But we are #1 with vaccinating seniors, and we're ahead by hundreds and hundreds of thousands, and we're one of only a handful of states that's vaccinated a third of our senior population. Some other states have done well. Obviously, we have a much bigger state, so getting to all these footprints is administratively and logistically more challenging, but people are doing a really, really good job. So seniors first. We've gotten a lot done. We're going to get more done. Now that we have the federal pharmacy program, that's in addition to everything that the feds had been sending the state. So we're having more vaccine as a result of this, which is great. We've also told the federal government if they're going to do some of these, if they want to do their own sites with additional vaccine, fine. Now, I think it's easy just to send it to us because I have so many places to do it. But if they want to do it and not take it out of our kitty and add to the kitty, that's fine as well. So I know there's discussions about them potentially doing that. At the end of the day, we want to get as much vaccine in the state as possible and get it to our seniors as quickly as possible. But just with the federal pharmacy program addition, we also got some more vaccine for this coming week, where the vaccines that's landing yesterday and today. So we're now about 325,000 just for the state's allocation that's going to the hospitals, that's going to the county health, that's going to our pop-up sites and drive-through sites. And so that's good because we were at 266,000 a week for most of January. Now you have the federal pharmacy. That's on top of the 325,000. And hopefully with the Pfizer production, we will be able to see an increase in production there and have even more of the Pfizer vaccine, hopefully in the coming weeks. We do anticipate the Johnson & Johnson vaccine to be approved at the end of the month. I think they should approve it sooner. You just have to work the weekends. You can work round the clock, but the sooner we get the Johnson & Johnson, the better off it's going to be for a lot of folks. And so kind of the next phase will be seniors the demand will start to wane, and I don't think it has waned yet. I think there's still tense demand. But as you get to 2.5+ million seniors, you're going to see the rest of the seniors. Some aren't going to want it, and some will take it but aren't necessarily crawling over hot coals to get it. If it's there, they'll do it. So if you start to see, once we start to see some softening in the demand, then we need to get the footprint wider. Obviously, there's people that are 63 and 64 that would definitely want it. And I know there's a lot of different occupations that have asked. So we want to do that as soon as we can, but we got to do seniors first, keep our eye on the ball, stand by the folks, our parents and grandparents, and we'll do it. I think over the next couple weeks, we'll start to get a sense of the effects that the vaccines may have on things like hospitalizations and infections. We've seen a big decline in hospitalizations in Florida. I think we're down to 5,300, where we had 10,000 over the summer. But I think probably that's the natural COVID cycle. We're seeing it all over the country go down. Whether the vaccines have contributed that, I don't know. But I think as we get further into February and more seniors have had the second dose, and we're seeing massive numbers of people getting their second dose now. I think we were averaging between 50 and 60,000 second doses last week during the week. And so you're going to continue to see a lot of second doses being given about a 7 to 10 day period after that to really get the protective effect. But when you have 1.5 million, 2 million seniors over the next few weeks that will have both doses, that's going to make an impact on these numbers, and I think move them in an even more positive direction. So we're looking forward to doing that. We really are happy to be here at Walmart. We've been talking with them from the beginning. They said they wanted to be helpful, and when this opportunity came, they were ready to go, and so they've been really good to work with. And I think it's going to make a big impact. You're going to see a big imprint in places like Duval. I know in Orange County there's going to be a big imprint. I know Broward is going to have a bunch. Dade is going to have a few. Some of these other areas that didn't necessarily have the big retail footprint with Publix. And so this is another great step in the direction of protecting our folks from coronavirus. I want to thank Mayor Curry for being here and working collaboratively with the state. Duval's done a really good job. And when you have 42% of seniors that have gotten at least one shot, that's way better than the national average for seniors, not even close. And that's about 10 points higher than the state average. And we're one of the top states in the country for percentages of seniors vaccinated. So good job to Jacksonville. Good job to Duval. And Mayor, if you want to come up and say a few things.
Thank you, Governor.
Yep.
Good afternoon. First, obviously, I want to thank you, Governor, and your entire team for your leadership and support in getting our most vulnerable Floridians vaccinated, especially our Duval County citizens, to the vaccinations for COVID-19. Thank you to Walmart for stepping up, not just in our county and our city, but all over the state of Florida, again, to make sure we're taking care of the most vulnerable. My team and I are focused on getting Jacksonville citizens access to the vaccine. The governor and his team have been amazing partners on that front. Just last week, we received an allotment of vaccines from the state, and on Friday and Saturday, we distributed the first dose to our most vulnerable neighbors in Northwest Jacksonville. I watched news coverage that morning of folks who were first in line to receive the vaccine at the Senior Center on Moncrief. Making sure they had access in their neighborhoods was crucial. In fact, the first two people interviewed told reporters they rely on public transportation and got on the first available bus that morning to get in line and get their vaccine. Thank you, Governor. That would not have happened without you. Today, as the Governor stated, we're here at the Walmart of Atlantic and Kernan to announce the rollout of COVID-19 vaccinations in Walmart stores. My team and I have heard loud and clear from Beach's leaders. I just got off the phone with them and residents about the need for vaccine access in this area of the county. This program meets that need, providing easy access for those that need it. While this announcement is great news, we're all aware that more work needs to be done, and we'll continue to work with the governor and his team to get vaccines to everyone who wants one. Until then, I encourage the people of Jacksonville to continue safe practices we've been doing since this pandemic started. Wear masks when you can't socially distance indoors, wash your hands, avoid large crowds, practice social distancing, take care of your neighbors. Personal responsibility is and remains our greatest tool in stopping the spread of this virus, and it lets people go back to work and our kids to be in schools and participate in activities. With that, thanks again for having me, Governor. I'll turn it back over to you.
Okay. Well, thanks a lot, Mayor. And you know, I'd be remiss if I didn't say that we saw on Sunday night the Buccaneers bring home a Super Bowl. Obviously, very exciting. But we also know there's been a lot of big news in Jacksonville to bring Urban Meyer into town as a coach. And I remember when they brought him into UF, it wasn't very long before they were the top program in the country. And obviously he's done well other places too. And then having the #1 draft pick, I mean, you know, I think the kid from Clemson is going to be a great player. You know, we'll see who they take, but that's who I would take. And so I think it's going to be exciting here in Jacksonville going forward. And so we look forward to seeing how that all works out. But, you know, just look. The Bucs went from, I mean, they had some good players, but they were not even playoff caliber. You make a couple key changes, and granted, you're bringing the best quarterback of all time in, but, you know, then the Super Bowl. So I think some of the key pieces are starting to fall into place for Jacksonville, and we're really excited about it. Well, I wanted Manisha Brown to be able to come up from Walmart, be able to put in a few words, and then also potentially answer any questions and explain some of the things, introduce the team here. and basically share the excitement, because I know Walmart, they have been involved in other states, and I think it's worked really, really well, and I think it's going to make a big difference in the state of Florida.
Thank you, Governor. Thank you, Mr. Mayor. We appreciate both of you being here for this announcement today. For all of you that know Walmart, you know that we are committed to serving the customers of our community, and we're also committed to providing affordable and accessible health care. So having an opportunity to be part of the strategy when it was COVID testing time, that was a huge commitment for our company, and we believe that it was an important one. And we are so excited to be part of the solution for vaccines. We hope that our customers will learn about the opportunity to get their vaccines in our stores, and we appreciate opportunities like this with the governor and the mayor to get the word out so people know. We know it's difficult to get the vaccine, but we want people to know that there are resources right here in their community. So thank you all for being here. Thank you for being part of the solution to tell that story, and we look forward to working with you.
All right, well, we look forward to seeing seniors be able to get access to vaccines here at Walmart in a way that's convenient. I'll also just say we're continuing with the missions that we've been doing, particularly working with religious houses of worship. We've done a lot of African-American church communities. We also did an interfaith alliance down in Aventura where we did Christian, Jewish, and Muslim. And we're going to continue to work in with our faith communities. We're also going to be setting up, well, actually continuing and expanding some of the pods that we have in underserved parts of the state. So I was out in Pahokee, right off of Lake Okeechobee, last week with my lottery secretary, and that was his hometown. We were able to bring vaccines to an underserved area. We're going to continue to do that. We're also going to find them in some other parts of the state. I believe Duval County will get one of those sites as well because they're doing a good job. And so we want to continue to do all those different things we do. We're also continuing with our homebound seniors program. So we were able to focus initially on Holocaust survivors in South Florida. Yesterday I was in Miami. We're doing the Bay of Pigs veterans from the 1961 Bay of Pigs mission. And that was a lot of them told me they could not come and get it themselves if we had not done that. And then we're going to have more announcements about doing homebound senior vaccinations. And so our philosophy is seniors first, all hands on deck in order to accomplish the mission. And as new avenues come up, we're going to see. Walmart's a great one. They got a great footprint. I think it's going to be very successful. Okay. Any questions? Yes, sir. So so Publix is all online. I believe Walmart's 100% online. So it is all online. And I think the reason for that is, and what I've learned just with how when there's a crush of calls, it paralyzes like with the phones. I mean, it's very difficult. So we have done phones on some of the state sites, and we've done it. We have the web platform that we help with the counties as well. But I think that from a perspective of a Walmart or Publix, the online really is the most efficient for them, and that's obviously their decision. If you can't get it, we're sensitive to that. That's why we do the homebound program if people aren't familiar with the technology, can't drive or things like that. So as we get more requests to do that in different parts of the state, we're obviously going to do it. But it is an online program. And what was your second question? Yeah, so they have gotten an allotment. I am not in a position to announce exactly where that is. I think we've tried to work with them on it. We're not really clear, but they are going to get an allotment, and they probably will have an announcement perhaps on their own sometime this week. Yes, ma'am. Sure, it's all about once we get through enough of the senior population where we start to see that demand dwindle a little bit and places like Walmart start to have some open reservation slots, then we're going to work to expand it. But I can tell you right now, we've done more seniors than anyone in the country by far, but we've still got a lot of seniors who still want appointments and want to get shots. So that's going to continue to be the mission. At current allotments, if we're getting 325,000 for the state, if the federal pharmacy is getting, say, 40,000, that is putting us in a range where it'll take a couple more weeks to really get through probably all the seniors who really, really want it. But as soon as we see the demand signal change, and if we can get more Pfizer and Johnson & Johnson, a combination of both or even one or the other, that will make a big difference. So I know there's folks who aren't in the 65 and plus who are anxious to get it. We want to get it to you, but we also just got to be mindful of the evidence on the coronavirus and who it's most likely to affect in the most severe way, and that is our senior citizens. We are seeing a decline in infections in nursing homes. Of course, we went in there very early, and it's a pretty sharp decline. Again, maybe that's just the seasonal wave. Maybe that's some of the vaccine kicking in. I think we'll know a lot more within the next couple weeks, and if we do see continued decline amongst the 65 and plus and nursing home population, then we know we're on the right track, and we just got to keep doing it. Yes, ma'am. So which site is that? Okay. So I'll follow up with it, but bottom line is we have said when the second doses come in, fill your appointments. Don't divert the second dose to first, just because we don't know until the week before whether we're going to get what kind of the dosage is going to be like. So what I didn't want is to have someone doing that. So if they haven't gotten it, we'll work and follow up with you and see why they haven't. We are doing a lot of second doses statewide. The numbers are going through the roof. And you don't need it right at day 21 or day 28. I mean, you can do a couple days on either side, no problem. But we want to get people signed up for it. And so we'll look at the Regency site and see what the sign-ups look like. And if there's folks that need it, we want to follow up with them for sure.
Just a follow-up question. At this point, are you only sending the vaccine doses to the state sites, or are you also still giving some hospitals?
Oh, yeah, for sure. So we're doing we're doing about a little less than 30,000 doses to hospitals throughout the state. And the hospitals really have been charged from the beginning, yes, 65 plus, but so is Walmart, all these other places. They're really the place that does the comorbidities. So if you're somebody that is 65 and plus with the comorbidities are irrelevant here. You can get it here, Publix, drive-through site. But it's really under the physician supervision in the hospitals for them to say, okay, you're somebody that has problems with your lungs. We need to vaccinate you because you're particularly vulnerable to COVID. So we need the hospitals to continue to doing that. So we are sending that amount. If we continue to get more, we will end up, we'll up the dosage wherever we need it. So this current week, some of the areas where that senior number is a lot less than Duval, they got a little bit more because we want to get those numbers up. As the hospitals are working through, we want them to be able, if they have cancer patients, they have those folks, absolutely, we want them to be able to be vaccinating them. And really, it's either got to be in a doctor's office or in a hospital for that to be done. I would hate to have a place like Publix where someone comes in and they're 35 and they say they have a comorbidity, and then Walmart or Publix has to referee that. I think we really want that under medical. One of the next steps forward when you talk about the categories, you also are going to look at what's the distribution going to be like going forward. I think the one big expansion that we will be looking at is just getting these things into doctors' offices. As the supplies increase, getting it, then the doctors can reach out to their individual patients, and you don't have to necessarily go to a centralized site, and we'll be able to do it. Johnson & Johnson will be really good for that because it doesn't require any freezing. But even the Moderna, most of the doctors will be able to handle it. So we're going to look at how can you do it across the state in an equitable way where you're getting it into doctors' offices. Yes, ma'am. One more? Yep. Do you have the list?
I can probably get you the list and help you figure that out. I don't know the sites exactly off the top of my head or locations, but my team is saying yes.
What's that? Oh, okay. There you go. Lynn Turner. Yeah. So I think and honestly, I think of all the counties that are getting Walmart, I think Duval has the most Walmarts of anybody where they're going to do the pharmacy program. I think we have 18 here. I think Orange County, is 17 Walmart locations. And then I think some of these other I think Manatee is probably 15, 16. Broward, I think, is at least 10. So there's some other spots, but Duval is number one for the pharmacies that are going to be carrying the vaccine. So we think that that's a really, really good thing. And we're going to keep supporting what the mayor's doing and obviously what Walmart's doing. As more doses come in, we have so many ways where you can get that out there and get it into the community. And so we're excited to, I think we're reporting close to 3 million doses have been administered. These reports, as I said, they lag 3 to 4 days, so we're probably well over that. And we're probably well over 1.5 million seniors, probably 1.6, 1.7 range, when you factor in the reporting lag. So that's great progress. Obviously, we got way more to do, and we're not going to stop until we do it, and we'll continue to put seniors first. Thanks, everybody. All right.